Hi, my name's Allison Smith, and I'm doing my persuasive speech on the Affordable Care Act. Do you want control over your health care plans and not the insurance companies? Would you like to have preventative care? Could you use coverage for pre-existing conditions? The Affordable Care Act was passed by Congress on March 23, 2010 that will restructure the health care industry. The changes will take place over the next 4 years, and most changes will be complete by 2014. The most important part of this new health care reform is to allow all Americans to have control of their health insurance plans and their health care instead of the insurance companies. This will stop the insurance companies from limiting patients' care and benefits and denying them coverage for the proper care they need at the time they need it, and to control the costs associated with the type of care they need. This is a way to control the insurance companies and the practices they have used in the past, and allow all Americans and businesses to control their own health care and health care programs. All Americans will be able to obtain health coverage. Every American will be required to purchase health insurance by the year 2014, and this plan is designed to ensure that lower income families will receive assistance in purchasing health insurance by receiving tax credits. There are many changes and benefits that all Americans should be aware of, and how it will affect them and their families. Businesses and insurance companies now have to follow strict government guidelines and restructure the health plans they will be offering as early as September 23, 2010, unless the plan has been grandfathered in. This new plan will offer preventative care for physicians, physical exams, immunizations, mammograms, colonoscopies, as well as many other types of screenings. Co-payments will no longer be required for these type of services. The parents will be allowed to keep their children on their policies until the child reaches the age of 26, whether they are married or single, a student, employed, unemployed, reside with the parent or not, regardless of what their tax status is. If the child is employed and their company offers insurance, then they would not qualify for this coverage. Children with pre-existing conditions will no longer be denied treatment or coverage, and insurance companies will not be allowed to drop any patient that becomes sick. If a person has a pre-existing condition and has been unable to obtain health insurance because of this reason, they are now able to receive coverage through their state insurance. Insurance companies are no longer allowed to set lifetime limits and annual limits on coverage. They must allow you to pick your primary care physician, your child's pediatrician, and you will no longer need a referral to visit your OBGYN. Most of the changes have already taken effect and were required to be in action by September 23, 2010. One of the benefits for people who are on Medicare and have a prescription drug program but are still unable to pay for all their medications because they have reached the donut hole, which is a gap in their insurance coverage, that once you have or the insurance company has reached a certain dollar amount for the drugs that are covered under your plan, the insured person now has to pay for all the medications out of their pocket with no more help from their prescription drug plan. Starting this year, they will receive a one-time tax-free rebate of $250 from Medicare to apply towards their prescriptions. From 2010 to 2020, if they reach the donut hole, Medicare will give them a 50% discount on all covered brand name drugs, and they will receive continued medical coverage on their prescription drug plans. The early retirement the early retiree insurance program that will take effect in 2010 and will help people who retire before they reach retirement age per the Medicare retirement guidelines, and their employers are unable to provide adequate or affordable health insurance coverage by providing employers with funds to help retired employees obtain health insurance coverage. Insurance companies are going to have to curb their spending habits when it comes to administrative costs, marketing, and other expenses that are not part of health care, and make sure that the money they receive from premiums are applied directly to the insured's health care. And if they do not do so, then they will have to provide the insured a credit or a rebate for going above the allowable amount that has been designated for these types of business expenses. And if they raise premiums, they will have to provide documentation to the state regulator that the insured resides in, as well as to the Secretary of State of the U.S. Department of Health and Human Services as why the premiums increases are required. For certain large company plans, the law requires that at least 85% of all premium dollars collected by insurance companies be spent on healthcare services and healthcare quality improvement. This rule affects you if you receive your health benefits through an employer with more than 50 employees and your employer buys coverage from an insurer. The limits have been placed on lifetime benefits will now make group premiums 0.05% or less, and a single plan premium will now be 0.75% or less. So overall, both plans combined will be 0.1% or less, unless the plans have been grandfathered in. By ensuring that all Americans receive medical care and health coverage, by placing restrictions on annual limits, rescissions, and lifetime benefits, and allow coverage or continued coverage for an adult or child with a pre-existing condition, the government is hoping that this will reduce the amount of people who have to file for bankruptcy because of previously high medical costs and medical bills they have acquired or that has added up due to a sick child or a family member. As the insurance companies become more responsible for those costs, this should allow Americans to be able to save again. They are also hoping that this will help with their productivity by eliminating the amount of time an employee needs to take off in order to take care of a sick child, parent, or other family member. Now, my visual aids are going to be my insurance cards. So this is my son's insurance card. Hope you can see that. And then my insurance card and my daughter's. And none of us were able to pick or choose our primary care physician. So now with these new changes, we will be allowed to do that. Thank you.